Good afternoon and happy July. I'm Terry Scoggin, the CEO of Titus Regional Medical Center in Mount Pleasant, Texas. And today is Thursday, July 1st, 2021. And it's time for our TRMC community update. As many of you are aware, we did these updates throughout COVID, and we did them on a consistent basis daily at some point. We went to monthly, and really, so today's being the first day of July, I'm kind of excited to be back. We are jam-packed with a lot of things that are going on at TRMC, but especially with July 1st starting, it's been a big day in the community. It's been the talk around the health system and in the studio here right before we got started about the stacks. And at the plant this morning, as they came down, it was a pretty emotional day in Northeast Texas and in Mount Pleasant because those stacks and that plant represent so much of many of your lives and many of our lives and much of this community. So just wanted to start with that. And as we get ready for the 4th of July weekend and all the festivities come along with, we wanted to give an update of the health system. And if you follow the comments along as we start, things that people are concerned about the COVID numbers. And, that's not what just this community update's about. At this time, though, I am going to start with COVID numbers because there are some things going on right now that I am a little concerned about. We are keeping our eye on. I want to make sure as a community, we continue to update you and give you the information you need to protect you, yourself, your family, and your friends around you. From a number of perspectives, you can see ups and downs. And the one that I focus on really is, those ICU beds. The bottom have been pretty consistent. But one of the ones we're going to talk about today is the different numbers as far as the confirmed cases. And we've been in that 30 to 20. Not as concerned as much on a daily basis of the people that are hospitalized, because this is number of hospitalized in Northeast Texas. But one of the things I'm watching for is this. As you can see, the Tyler numbers are starting to go up. And then from a Dallas perspective, Dallas numbers are starting to go up as well. As you can see, they start increasing over the last 10 days. And if you remember from a COVID perspective, when we talked about a few months ago during COVID when it was highest, we were about 2 to 3 weeks behind the Dallas and Tyler area. One of the things that I've watched is this is on Johns Hopkins surveys that they put out on a daily basis. Titus County and Bowie County has been watching. But you can see the number of cases that have happened over the last few days. We had 52 cases reported this week on one day. So you see that increase that's happening on a daily basis. Bowie County had the same thing. So that's one of the things that I'm concerned about as we talk about Titus and what's going around us as far as from a community standpoint. I encourage you on a consistent basis to check out our Facebook. Our marketing team is working closely with our clinicians, our physicians, and our nurses in different areas to get information out on a daily basis. And one of the things we have been doing for the last 16 months is trying to communicate. There's a great article on Facebook written by Dr. Thurman. I would encourage you, if you get a few minutes, to go to our Facebook side and check out that. It's about the Delta variant. The Delta variant's about 20% of the cases in Texas, as far as the COVID cases, are the Delta variant. I can't tell you how many of those are Titus. It takes almost 4 to 5 weeks to get back the information of a positive of what variant was. We send it to the state. The state does follow it closely. The one thing that's concerning us is it is more transferable. I think the number was around 60% that I saw. That's more transferable than the other variants of COVID. So it's something we need to look out for. Even though the mortality rate is not as high as this variant, people are getting sick. If you go back to the original numbers I showed a few minutes ago, you can see that increase in hospitalizations that's happening, which is consistent with this Delta variant. So it's a great article by Dr. Thurman. We are working with a few other physicians to get more information on that and get some of the articles they've read and that they're participating with out to you. So follow us closely on Facebook. If you don't follow Titus Regional, I would encourage you to. We'll continue to get that information out there. One of the things that happens on a daily basis is masking, and I have had my backside chewed out a couple times this week by different people who are coming through the health system and friends of mine asking about masks. We are still continuing to wear masks, and we still will wear them for the foreseeable future. CMS or Medicare has mandated that hospitals screen and maintain mask policies. So we will continue to do that. We have seen a decrease in transferable diseases because of wearing masks in the hospital. We will continue it. I do appreciate the concerns, but I would appreciate just the support and patience of the community, as all these things that we have in place are purely just to protect our patients, their visitors, and our healthcare workers. From a vaccine perspective, this is one of the things I just want to get into numbers and really talk about. We're still continuing to see the increase. From a community standpoint, Northeast Texas is falling still below the rest of the state. One dose eligible is the one that I focus on. 52% of Texas is vaccinated with one dose, 12 years and up. Northeast Texas is 37%. Titus, as you can see at the bottom, is 38%. So we are above the average for this region. And the one thing that we're starting to do is get closer on the fully vaccinated. We were behind in Titus County for many weeks and many months, actually, on fully vaccinated. And really, since the push in April, you can see that increase. And being at 31, much closer to the region average, and we're getting closer and moving up, and we'll be ahead of the region's average in the next few weeks. Northeast Texas still falls way below the rest of the state from a vaccine percentage standpoint of the 12 and older. So that does concern me. It's one of the things that we're looking at. We are pushing our vaccinated Texas. Our clinic is open 4 days a week, Monday through Thursday. We're trying to do things to make it quicker, to get things out there. You can go to our website at titusregional.com, click on the Vaccinated Texas, and go to the schedule and schedule your time. Walk-ins are available. We are giving the Pfizer and Moderna vaccine, but they're open every day. And we're doing that at no cost to our community members. On Tuesdays, we do have extended hours. So I would encourage you, your friends, take advantage of that opportunity, get in and get your vaccine. We're going to continue to do it as long as we can continue to get the supply from the state of Texas, which we have that support, so we think we're fine. But it's pretty easy. You can go on our website. We also have some signs here at the hospital where you can scan in. The team's done a great job of trying to link everything together and make it easy. But it's on the first floor of the hospital. You don't have to go very far. You get to see the great team down the vaccine clinic and come back at 21 or 28 days, depending on which vaccine that you have. So we'll transition a little bit now from COVID and the vaccines to what's going on in the health system. It's going to be a busy summer. I'm excited about a lot of things. I'm excited about as we continue to grow and we continue to do things that are going to be advancements in our community. But yesterday was a special time. As of June 30th, and we start July, we had a couple retirements. And Ms. Pogue has been a part of our auxiliary, our pink ladies, the pink team. She's been a smiling face for over 31 years. And what's interesting to me is you can see where her name badge goes on her left side there, you see a long train. That train is the number of hours that they've put in and volunteer. And you see the number of hours that she's put into this health system and this community of volunteer. So we had just some cake yesterday and some time with her. But just wanted to thank Ms. Pogue and her family for the 31 years of service that she gave our health system. Another one yesterday who retired is Miss Linda. Linda Thomas has been in our accounting department. She's been in our patient financial services or billing department for the majority of the years she's been at Titus. I've been at Titus for almost 10 years now. Linda's been a close personal friend and helped in a lot of the things we've done in the patient financial services. I've seen her face many times when I've gone to the billing office and helped other patients, myself. She's made a difference in this community and a job sometimes that's tough, dealing with financials and billing, especially of a health system. But Linda's done it with a smile, and she cares about the people of this community. So to Ms. Pogue and to Ms. Linda, I want to thank you for your service to not only Titus Regional Medical Center, but your service to your community. We're grateful that you've been a part of our team. We also, on Tuesday, in our leadership huddle, Ms. Rhonda celebrated 40 years of service. It was actually yesterday. We took the picture on Tuesday, but it's exciting when I get the chance to just celebrate some of our team members. She's our fourth longest tenure person here at the health system. So we're excited that we got to celebrate her and get her picture out there this week. But Miss Rhonda is in our lab department. She focuses microbiology, but has been just a foundation and great person to have on the third floor in the lab. I've had the privilege of playing or coaching her son in baseball over the years and getting to know her outside of the hospital as well. But it's a great person. We're excited to celebrate her years of service. One of the things you're going to see, you've probably read about it and you're seeing in the news, we'll continue to hear us focusing on is we have a blood shortage. Not only here at the health system, but across Northeast Texas and across the U.S. And a lot of reasons for that. COVID is generating some of those, but you will see more blood drives in this area. We're going to put some things out there to try and push more blood drives, let you know where they are. But if you are able to give blood, this is the time of year that I would encourage you to do that, give that blood. There is a shortage, and we're seeing it on a daily basis. We're tracking it. So it's one of the things that concerns hospitals in Northeast Texas and across the state. But I would encourage you just to watch out for your blood drives. We'll be doing them each month here at Titus. Our next one's on July 19th at the health system. More to come on that, and we'll send some more things out. Another thing we're excited about, August is going to be a grand opening for us. We'll be opening the Community Care Center at Titus. And Dr. Anna Hollingsworth will be joining our health system. Will be a female primary care doctor. And Ryan Bellaw, who is a advanced healthcare practitioner, will be partnering with her to open a new clinic just across the street from the hospital on 20th Street. It'll be two new primary care providers in our community here, so we're excited about it. Ed is a special person, and Ryan's been just a great guy over the last few months as we've gotten to know him and him participate in some of our calls that we're on. But Dr. Hollingsworth will be joining us, and it'll give us a female family practice provider, which we're excited about. I know from a community, when I talk out there to different groups, they're excited to have her as well. One of the things just wanted to, I've gotten some texts over the last few weeks, and I wanted to know why we're going under and that we're going out of business. And I think a lot of that's being driven. Last summer in July, we actually had a documentary crew come in here. They asked from New York to come in and walk through the COVID surge. It was our second surge at that time, and they wanted to see the impact of a rural hospital. And we did the story with them. The story won some awards in the documentary world in February, but it really got into what was going on and what was the challenges we had a year ago. And I will tell you, at the beginning of COVID, there were financial challenges along with all rural hospitals. But a couple weeks ago, we were asked by Soledad O'Brien, as a matter of fact, to do a follow-up. Quite a few rural hospitals across the United States are in a challenging market, with 4 hospitals that closed within 40 miles of here in the last 7 years. We've seen it in Northeast Texas. Our health system has done a lot of things over the last 16 months to get through COVID and put us in a position that will be successful going forward. We've done some great things in the last 12 months, continuing to do some things, especially with the community and the different things that we're opening. So we're moving in the right direction. And that's what the story was about. While other rural hospitals are challenging, where are we from where we were last year? And where are we going? And what are the challenges that we have, especially as the last independent rural health system in Northeast Texas? What are those challenges? So it was a good time to sit and talk to her. We did about a 30-minute interview. They splice it and dice it, and it's about 2 minutes from there. But it was a great opportunity to tell the story and tell why hospitals and health systems in rural communities is so critical. And it's personal. Because I know you know me. We see each other at church, at Walmart. You see your doctors there. It's personal. It's not a big health system where you don't know somebody's name. It's critical that everything that we do is done the right way. So you'll see that article come out. We're going to put it on our Facebook and show it to the community as well, so you can see some of the challenges that we go through, but some of the great things that we've done as well. One of the other things that we're excited about that we're launching last week and we'll be working on in July is we did receive a community collaborative grant opportunity from American Hospital Association. We'll be partnering with the city of Mount Pleasant to work on improvements in some community health projects. One of the focuses for the next 12 months for us is coming out of COVID is can we give back as a hospital and health system to our community. So you'll be seeing some community projects that we'll be focusing on, some expansion. Not just physician offices, but some health offices throughout the community. So we're excited about that. You can see on the screen right there the 20 communities. Not all were hospitals, some were health centers. We were one of the few rural hospitals in the United States that was selected from our proposal, one of the smallest ones there, but we're excited to participate in this project. We'll be doing some things, and we'll keep giving updates from there. I'd also like to encourage you as we get closer to July 4th, it's a busy time in our emergency department. And it's amazing to me every year of how many injuries that we have when I talk to our emergency department team from fireworks. So I would encourage you to talk to your grandkids, to talk to your kids. Probably the worst person in the world to ever sit in front of you and talk about fireworks safety, especially after raising 3 boys here in Northeast Texas. We've done some silly things. But after working closely with some of my friends in the emergency department, I see what comes through. sometimes we don't think. So I would encourage your family to take a look at Facebook and what the EMS team, that's on Titus Regional EMS, but our ambulance team who gets called is the ones who came and put something together. So I would encourage you to do that and kind of think twice as we go into it. And want to end today on just happy 4th of July. And as we celebrate this year, we're still going to deal with COVID. COVID's not going to go away, but we are doing things differently this year. We are moving forward, and I just wanted to thank everybody. A lot of our things will be open on Friday and Monday, with the 4th being on Sunday. We won't have too many closures, but we'll have a few closures and a few offices on Friday and Monday. But we're excited to celebrate the 4th of July, and I just want to wish this community a happy 4th of July, and then just thank you for your support of our health system during COVID and post-COVID, and our partnership we have in Northeast Texas to make a difference in this community. We are creating healthier tomorrows. We are making a difference, and I wanted to say thank you. Have a great 4th, and we'll talk to you in a few weeks.